Okay.
Sure.
On healthcare, just the last thing you were talking to Major about. On
Okay.
another aspect of healthcare, a long story in the New York Times saying that large segments of the faculty at Harvard University, where President went to Harvard Law School, of course, is sort of up in arms about the fact that the professors are going to have to bear a larger share of their own healthcare costs under the President's new law. These are some of the same professors who were advisors to the President's first campaign in 2008, advocated the Affordable Care Act. And they basically said, this is a great deal for America. But now when they have to pay more, they're up in arms about it. Isn't that a little bit hypocritical as some of the President's supporters at Harvard are saying, this is a great deal for America, but when I've got to pay more, it's terrible. It's awful.
I can only imagine the question you'd be asking me if the New York Times reported that the faculty at Harvard was getting a great deal.
Well, this is the fact, though. And Harvard also put out a statement, by the way, saying the trend they're doing this because the trend of rising healthcare costs, including some driven by healthcare reform itself. Yesterday, when we talked about this, you said, and there are stats backing up, the healthcare costs are coming down in some respects. But Harvard is citing that the law itself is raising healthcare costs. Isn't that the opposite of what the White House says?
Well, I haven't seen exactly what Harvard has said, but I do think as a general matter that the results that we've seen so far, they're early, but the early results speak to the enormous benefits that the Affordable Care Act has paid to middle-class families across the country, to small business owners, to the government's bottom line, and to the success that we've had in lowering healthcare costs, or at least slowing the growth of healthcare costs for people all across the country.
Disappointed that professors at his alma mater just don't see those benefits?
Well, let's be clear. There are some important benefits that they do see under the Affordable Care Act. That there are a number of patient protections that apply to everybody. So everybody who's on the Harvard faculty can get a free annual checkup from their doctor. And again, that's thanks to the Affordable Care Act. Nobody at Harvard who has a pre-existing condition can ever be discriminated against again because of that pre-existing condition. And every a Harvard professor that has an old child can keep that child on their quality Harvard insurance up to age 26. And those are the kinds of patient protections that don't just benefit those at the bottom of the income scale. They actually benefit everybody, including the esteemed academics at Harvard University. John.